Thank you, Mr. Vice President. The decision before us today has been presented year after year since 1968. Since then, Palestinians and Syrians have used this annual ritual to attack Israel and to absolve the Palestinian Authority of its responsibility for governance. It has also been used to divert attention from decades of atrocities committed by the Syrian government. This decision has never been about health. If this decision was about health, it would address the systematic and deliberate militarization of health facilities in Gaza by Hamas and by the Islamic Jihad. Health facilities in Gaza are used as hideouts and launch sites for terrorism, as shields for underground terror tunnels, as weapons arsenals. Hamas is deliberately putting the safety of patients at risk. Everyone in this room is well aware of it. Evidence of this militarization was found in every hospital in Gaza. At Shifa Hospital, for example, there were more terrorists than patients. Israeli forces apprehended some 500 terrorists and eliminated hundreds more. Many branches of Hamas' entire governance systems was conducted out of Shifa. The managers of the Kuwaiti hospital, the Al-Najjar hospital, Emirati hospital, and the Kamal Adwan hospital were all Hamas military wing operatives. All these findings have been made public and shared with member states here and WHO. Yet, the World Health Organization has remained silent. If this decision was about health, it would address the plight of the 125 hostages who are still being held by Hamas in Gaza. It has now been 236 days since 16-month-old Kfir Bibas and his brother, Ariel, were taken hostage. It has now been 236 days since young Israeli women were abducted into Gaza with blood-stained pants, limping, and still being abused by terrorists who labeled them sex slaves. Are the hostages not deserving of protection, of life itself? The testimonies of released hostages are tormenting. Released hostage Moran Stella Yanai told me that she was taken to a hospital and begged for doctors to help her. Released hostages Sharoni Aloni Cunyo and her twin 3-year-old daughters were held hostage in the Gaza hospital. Her husband David remains in captivity. Released hostage Amit Susna stated that she was forced to commit sexual acts at gunpoint. Testimonies speak of torture, sexual assault, physical and psychological abuse. Released hostages continue to endure psychological trauma of captivity. A decision on health that does not demand the immediate and unconditional release of all hostages is an unforgivable moral failure. A decision that does not condemn the militarization of health facilities by terrorists in Gaza has no intention of improving the health conditions on the ground. If this decision was indeed about health, it would address these issues. Mr. Vice President, the toll of this unwanted war has taken on the civilian population in Gaza is indeed tragic. This is first and foremost a result of Hamas' systematic strategy of maximizing civilian harm. Since the beginning of this war, Israel has taken numerous measures and worked with partners, including with the World Health Organization, to ensure that civilian population in Gaza has access to medicine and emergency health care, including by facilitating the establishment of 8 operational field hospitals and 3 mobile clinics. 3 additional hospitals initiatives are currently being reviewed. Since October, Israel has also enabled the entrance of over 23,000 tons of medical supplies alone. We have opened numerous humanitarian crossings into Gaza, which have been attacked repeatedly by Hamas. Israel facilitates it, while Hamas attacks and diverts it. This is the reality. The authors of this decision have intentionally omitted the reality where Hamas exists and brutalizes Israelis and Palestinians alike. But reality actually does matter if this organization indeed wants to improve the health condition of the Palestinian population. The draft before us today duplicates much of what was already adopted at the EB in December 23 and in January this year, and will also be discussed tomorrow. Yet once again, when it comes to Hamas, this decision is silent. WHO is silent. This is a blank check for terrorist organizations to continue attacking, murdering, and raping Israelis with zero accountability. The decision presented here today is problematic in many ways. I have pointed only some. I did not mention the fact that the health conditions in the Golan Heights and Eastern Jerusalem are identical to those in Tel Aviv, which begs the question of the relevance of this decision. Despite its many failings, we have decided to concentrate on the decision's most glaring omission, the plight of the hostages and the systematic use of health facilities in Gaza by armed group. Israel therefore proposes to amend the decision by including a new paragraph 26, and because of time, I will not repeat it. I will just emphasize it was circulated in document A77/B/conference/3. We can find the amendment there. I hope this amendment, which is the bare minimum, will be adopted by consensus. I thank you.